Welcome to today's presentation over how to engage the non-adherent patient. My name is Megan Francis. I am marketing coordinator here at Updox. If you have registered for this webinar, obviously you or someone you know has run into trouble with patients not necessarily engaging or adhering to your wellness plans and medication schedules. So let's go ahead and dive right in. Updox has worked with independent physicians for nearly 8 years. We haven't even begun to uncover the amount of work that goes into every single patient you care for. As the healthcare industry moves from volume-based to value-based, engagement's a key factor at improving your patient's outcomes. So follow-up from a provider is critical to these outcomes, but what if your patient doesn't exactly follow up themselves? There are countless hours spent in the day devoted to your patients, whether that be scheduling the appointment, you or your staff reaching out or having them reach out and talking them through that process. If they're a new patient, researching their history, the appointment itself, so talking out their health with them during their appointment, thinking out the right treatment process, discussing their options with them, coordinating with the full care team, and then implementing your plan. But then what? You have to really depend on your patient to engage with you and adhere to your plan, schedule, and follow-up. But studies show that more than 50% of patients have no intention of holding up their end of that follow-up bargain. So there's been a lot of mixed reviews on what patient engagement means or if it's important in the healthcare field. However, there are new studies proving that there are psychological factors that determine whether or not patients' engagement has a factor on their adherence to treatment plans. A recent study of cardiovascular patients states that it's simply patients that are more involved in their healthcare prove to have better health outcomes. So how exactly do you get your patients on your radar? A Millward Brown study says that 90% or over 90% of adults have their smartphones within an arm's reach away at all times. I know mine is sitting right beside me. I'm sure those of you attending today's webinar or registered for today's webinar could probably look around and see their smartphone right beside them. So what does that mean for your practice? It means by engaging them where they already live, their phones, you have access to creating the type of relationship that promotes a successful healthcare experience and overall better patient outcomes. Now we're going to hit on 3 strategic things you can do and the tools associated to build a trusted relationship with your patients. First of all, keeping them informed, so assessing their knowledge of their illness and creating an educational strategy to keep them up to date on screenings, information, and new offerings at your practice can definitely impact their engagement. Secondly, implementing a clear and secure method of communication for you and your patients can help their engagement. Third, engage with them in a method that they prefer. That can mean notifying them of an appointment, giving them access to their healthcare records, or sending them a quick text to update them on test results or new medications in the office. As long as you keep them involved, they have no reason to fall off of your care plan. Cue the Updox logo. So Updox was started about 8 years ago by a doctor to help other practices as he was frustrated by the lack of software solutions available built specifically for independent practices. From the very beginning, our mission has always been to help practices reduce manual process, just to help make life a little bit easier and give you more time to focus on your patients. So Updox is a communication platform built by physicians for physicians. We've got over 56,000 providers and 300,000 users, and it's constantly growing. We have over 100 EMR integrations, and that covers 72 million patients. So Updox truly is your single source for patient and provider communication. At its core, Updox is a communication platform designed to help the independent physician create the best workflow for their practice. We've built solutions to counteract those specific challenges you face on a daily basis. So we've created key solutions to help improve efficiencies around the independent workflow. Today we'll touch on just a few of those that help directly engage your patients and keep them engaged. specifically the patient portal, on-demand patient notifications, and automated appointment reminders. Moving forward in the digital age, you need solutions that aren't hindering your process. Updox has built some key solutions that run in the background of your current workflows. So we've got easy setup and automation that creates consistency in your daily workflow. We have on-the-fly messages, providing you and your staff a tool to directly message your patients. And Updox has supplied independent practices with customization that allows you to tailor messaging to fit your personal practice style and strategies. The first patient engagement tool we're going to touch on is our Updox patient portal. With the patient portal, your staff can easily share PHI, securely message back and forth with patients, pre-populate common forms or registration forms, and give patients access to new information. So your staff can easily run reports on updated demographics if you want to target specific demographics. And it's also used for online scheduling. This is just a quick video to show you how easy our online scheduling tool is for your patients. Just pick a time and go, and it will update you, notify your calendar, and move forward from there. The second patient engagement tool we're going to go over is our automated appointment reminders. So it's another important functionality to alleviate the time spent manually calling patients and engage your patients in a way they prefer. So we reduce and even eliminate the no-show rate. We free up that time spent by your staff reminding patients. We help fill canceled appointment slots, and we engage patients in their care, again, in a way that they prefer. The Updox difference is that you set up the appointment reminders during your training, and you just let it run from there. Most staff won't even know it's there except for the amount of time they're spending off of the phone. So a recent interview with one of our users says a lot of staff members don't even know what it is because it all runs in the background. But those that do have had a really easy experience starting it up. Only a few key staff members were necessary for it to be totally functional. Again, easy setup. You're actually able to preview your messages as you set it up. So our reminders are based on patient preferences. So if you have a demographic of patients that you know will not want a text message, no worries. Set it up for just email or phone call. Again, these are totally customizable, so you pick the preferences based on your patient needs, and you would know them better than anyone else. So you have three options. You can choose from email method, telephone call, that includes a human voice option, or an SMS text message. We have a super simple dashboard as well, just so you're able to run reports on whether or not your patients are confirming, declining, or not responding at all to these messages, and then be proactive from there. You can also see this schedule and dashboard on the go. Since we are web-based and accessible anywhere with an internet connection, you're able to view all of this data just on your phone, your smartphone, or your tablet. Anywhere you are, you're able to access Updox. So this boils down to the impact of a successful appointment reminders solution. In addition to time saved by staff on the phone, more time to care and engage your patients, they're actually showing up for their appointments now with a clear boost in revenue. The next solution we're going to go over is our on-demand patient notifications, or Updox blast messaging. Again, it's a great tool to build that trusted patient relationship. All of our messages are based on patient preferences and delivered in the method they prefer. So you can engage your patients, build those tailored messages via text, email, or phone call, and you can target specific patient segments. So rather than the reminders, which remind based on your calendar, you can actually create lists and target patients specifically. Some of the use cases are happy birthdays, Inclement weather. If you live on the East Coast like us, it was about 60 degrees yesterday, and now it is snowing and raining outside, so it's pretty nasty. If you happen to close down your office for the day and you need to let not only your patients, but everybody in your address book know, you can build a list from there and send out that tailored message as you wish. You can also educate your patients with the BLAST tool and let them know of upcoming clinics. Or we've recently talked to a physician that uses our BLAST notifications for letting his upcoming kindergartners know that his annual physicals are coming up. And he's seen a real boost in attendance from that. Again, easy setup and easily run by your staff. Personalization tokens are actually used to deliver the most personalized messages possible. So you can use your practice specifics and your patient's information to customize a tailored message totally unique to your practice. The key functionality that makes BLAST so special, as I spoke on before, is the segmenting option. You can build lists based on certain patient attributions or send messages to everyone in your address book as necessary. And just like our reminders, Updox provides BLAST reporting as well. So you get this awesome dashboard if you happen to be sending out a message to let everyone know that your office was closed for the day. Rather than having to call, email, or text message all of your staff and patients on the schedule for the day, you can see here who exactly received the message, when it was sent, what type of message was sent. And then if for some reason the status doesn't say delivered or opened, you can just call them accordingly. So you're saving a ton of time off of the phone there, but still personalized messaging with your patients. BLAST messaging sends patients messages the same 3 ways as our reminders options, but does it for any other reason except for an actual appointment reminder. On-demand messaging sounds nice. It saves you time off the phone, but it has a real revenue impact as well. So the last solution we're going to go over kind of rolls everything up into a neat bow. This is the actual universal inbox. So your reminders, your BLAST messages, your portal messages, all of that is going to flow into one place, along with all of your fax and secure messages from staff. And this is our dynamic editor that's included within our universal inbox. So that faxing option, you're actually able to preload forms, drag and drop them into the Updox inbox, and then edit as needed. We can also add physician signatures or provider signatures accordingly so that they're able to be tagged in forms and then sign as needed by your staff. So again, the biggest thing is the bottom line. What kind of ROI impact does an electronic fax solution actually give to your practice? So the average amount of time for every 5,000 fax pages is about 55 staff hours, and this is for a manual fax machine. And that's over $155 in supplies. So you've got your $72 for toner, you've got $50 for a case of paper, $20 to $40 for a fax line, and then all of your staff hours. If it takes 2 minutes for every fax page, the considerations include walking to and from the fax machine, reloading or scanning documents in, manually faxing it out, trying to scan to the chart, locating or duplicating that work if it gets lost. All of this definitely has an impact on your day-to-day grind. So implementing solutions that actually work and alleviate some of these daily workflows definitely helps your practice engage your patients and improve just efficiency overall. So to wrap it up, the 3 things we talked about in the beginning: first, you want to keep your patients informed, streamline the communication with your patients, and engage them in the methods that they prefer. You can do these with tools like Patient Portal and on-demand BLAST messaging. You can streamline secure communication with our on-demand messaging and appointment reminders, and engage them with all 3. So we've touched on the ROI impacts of just a few of the solutions, but we've seen that the practices using the overall Updox suite has a huge impact on their ROI. Whether or not they're using the paperless fax, BLAST messaging, or appointment reminders, you are saving an annual savings of $28,500 in revenue. So how do you get started with Updox? Again, we have a 15-day free trial, no hardware, completely web-based, so you're able to access us anywhere with an internet connection. No contract, we are month to month, so if for any reason you want to test Updox out for that first 15 days, you might not see the benefit, no worries, we will give you back your number and you can cancel at any time. We also have free training and free support. And for a limited time, we are offering a promo code SHOWERS, and you can get up to 50% off for your first month. So please feel free to contact us at the number or email below and get started with Updox so you can see the impact Updox can have for your practice.